Good morning or afternoon, depending on where you're living. My name is Dr. Carolyn Jones, and I'm a clinical geneticist at Rush University Medical Center in Chicago. I've been treating Fabry disease for over 20 years, and I'm privileged to work with individuals with Fabry disease by helping them find ways to treat their condition. I'm joined today with Travis, and we're going to talk about understanding the hidden impact of Fabry disease.
Hello, everyone. Thanks for joining us. My name is Travis, and I was diagnosed with Fabry disease about 20 years ago. I started my journey when I was 4 and got diagnosed when I was 15. My biggest symptoms when I was younger were stomach problems and pain in my joints. And like most of you, my path to diagnosis was a runaround, seeing a lot of different doctors that couldn't figure out what was wrong with me. And since I felt tired all the time, the doctors simply chalked it up to growing pains. No one could figure out the stomach stuff either. We saw different doctors and they would try different things, but I was misdiagnosed a lot. One of the doctors sent me to see a dermatologist to get my rash looked at, and that was it. I finally had a diagnosis. It was a relief to actually know what was wrong with me, but it also wasn't, because it started a whole new journey. And when I was diagnosed, there were no treatments for Fabry disease. And I was like, great, I know what I have, but now what do I do? It was tough, and I felt lost. I wanted to run away. So I got on my bike as a 15-year-old with nowhere to go, and I kept going for hours. But ultimately, I had nowhere to go. I was concerned and worried all the time, wondering if there would ever be a treatment available and what was going to happen to me. When the first treatment was finally approved, about 15 years ago, I got on it. But my symptoms never really got any better, and since it was such a burden, I eventually stopped treatment. But that didn't help me either. My symptoms remained, and some got worse. Joint pain, GI symptoms, fatigue, heat and cold intolerance, shortness of breath, headaches, lymphedema in my legs. All these symptoms grew in frequency and continued to worsen as I got older. The fact about it is, if you look at these pictures of me, you would never suspect I have Fabry disease. But I do. And the most frustrating thing to me is that when I go to the doctor today, I look like a rock star on paper. Yet I struggle daily. Dr. Jones, can you help us understand why these symptoms happen to us and share some thoughts on how to deal with them?
I certainly can, Travis. But before we can understand what Fabry disease is, we need to look at normal. So here we have a picture of the cell. And inside all the cells in our body, we have something called a nucleus. And the nucleus carries all of our genetic material. We have over 22,000 genes. I like to think of genes as like recipes to tell the body how to make things. We actually have 2 copies of most of our genes, one we get from our mom and one we get from our dad. And they're located on something called chromosomes, and we have 46 chromosomes. Chromosomes 1 through 22, there's 2 copies, they're identical, and then there's the sex chromosomes. And I'm going to talk about that in a few more minutes. But what I'd like to do is talk about organelle inside the cell called the lysosome. The lysosome is the great recycler of the cells. Our cells are green, unlike us. So whenever we're done with something, whether it's part of the cell membrane or an enzyme or whatnot, and we're making new stuff, we send it to the lysosome. There's a chemical called GL3. And everyone has this chemical. It's a glucose and a lipid kind of put together. It's called a glycolipid. So the name for that is GL3. It has actually a bigger name, but I can't spell it. So anyway, when we have some of this GL3 in the lysosomes, we use this enzyme, alpha-galactosidase A, which is actually coded on the DNA. It's actually coded on the X chromosome. And we break it down. And it's gone. Yay. But the problem in Fabry disease is, like everyone else, this GL3 is sent to the lysosome. But the gene that makes the enzyme alpha-galactosidase A has a spelling error. And it either doesn't make any enzyme or it doesn't make the enzyme correctly. And as a result, it can't break down the GL3. And so GL3 just keeps getting sent to the lysosomes, and it accumulates and accumulates and accumulates to the point that this lysosome, this little organelle, ends up taking over like almost the whole cell. Now the problem with that is the cell becomes so large that it starts impinging on very small blood vessels. And the smallest blood vessels are known as a capillary. So the blood comes out of the heart, it goes into the big arteries, the smaller arteries, and the smallest are called the capillaries. And the capillary blood is important to get to the organs, to the cells and the organs to give them nutrients. So when we can't get the blood past here, our organs, our cells are not getting the nutrients that they need. The organs with the smallest capillaries, the most and the smallest capillaries, include the kidney, the heart, and the brain. So we're going to talk about why that is so important in Fabry disease and why patients with Fabry disease are having more problems because, unfortunately, they're not able to, these organs have these small capillaries, so they're not breaking them down. Most of you have been diagnosed with Fabry disease, but not everyone looks the same. Classic Fabry disease usually is diagnosed in males, and the onset of symptoms are usually between ages 4 and 8. Although I have to be honest with you, I rarely see a child between 4 and 8 unless, one, they come from a family with Fabry disease and people thought to do genetic testing on them, or two, newborn screening. A number of states have actually started looking at deficiency of this enzyme on newborn screening, and we're hoping that we'll be able to identify individuals early so they don't go through the unfortunate, odyssey that Travis did. The second is late onset, or known as type 2 Fabry disease. And this usually occurs in males. The onset is usually between 25 and 40. But instead of all the symptoms, which we're going to talk about in the next slide, it's limited to heart and kidney issues, and even looking back, they didn't have some of these other issues. And finally, females. I would just like to say, and this is important for when you're talking to doctors as well. When I went to medical school, I was told women didn't get Fabry disease because it was on the X chromosome. And they have 2 copies of their X chromosome. And in all other disorders, if you have 2 copies of the gene, as long as one's working for an enzyme, it's probably plenty enough. The problem is, one thing that we've learned over time is the X chromosome is a really unique chromosome. So I told you earlier, boys have 1 X and 1 Y, and girls have 2 X's. The Y chromosome really determines if you're a male. So if you have a Y chromosome, you're a male. The X chromosome is a very large chromosome. It actually carries, it's one of the largest chromosomes, carrying thousands of genes, thousands of recipes to make things. And so females have 2 of these. So one of the X's is actually turned off. So imagine you have 2 copies of your X chromosome. One works for the enzyme and one doesn't. In some cells, if the X that's turned off is the one that makes the enzyme, all you got is the one that doesn't. The one that's active isn't making the enzyme. And in other cells, the X that's inactivated is the one that doesn't make the enzyme. Well, the problem here is that as a female, there are some groups of cells, and this event occurs very early in embryonic development. So there's little pockets of cells that make the enzyme and break down the GL3, and everything's great. And then there's other parts, parts of even an organ that isn't making it. So just think about the heart. You have like little pockets in the heart that are accumulating GL3 and maybe obstructing small capillaries. And the kidney, the good news is most people have 2 kidneys, and you only need about 1/4 of one kidney to be in good shape. And so females have little pockets of both of their kidneys that aren't working, but usually that doesn't cause them a lot of symptoms. And again, that's another reason that I think people just said women didn't get Fabry disease, because they didn't have the historical kidney disease. But there is some damage, and some people have, like, unfortunately, maybe more of their kidneys have the copy of the gene that's not working on. Some people, that just happens. So females, even within a family, can have a lot of variability in their symptoms because of that. But a female is not a good candidate to be donating their kidney to anybody with Fabry disease. So, even if somebody's begging you, your kidney, A, you need both of your kidneys, and B, your kidney probably wouldn't help a relative that has Fabry disease much because it's got little pockets filled with this glycolipid. So that's just a little pearl there. But the next thing I want to do is talk about many parts of the body, in addition to the kidney, heart, and brain, are also affected. So let's go through these and look at them. So recurrent fevers can occur, memory problems, headache and fatigue, and everyone is affected a little bit different. There can be ringing in the ears, and I've had patients with their first presentation is ringing in the ears. Hearing loss, it can be progressive or very quick. Vertigo is when you feel a little like unbalanced. Abdominal pain is a major issue for some patients, certainly not all. And sometimes it's associated with constipation, diarrhea, nausea, and sometimes it's just abdominal pain. The next thing is deposits in the cornea. There's two things that can happen. One is some females come to medical attention because they have deposits in the cornea, and this is known as a whorl keratopathy. It doesn't cause any issues, but it's something that the ophthalmologist sees and may, recommend further testing. But the second is there can be deposits in the eye that can result in cataract. So I always say that the ophthalmologist is my best friend because they can, find things early because the cornea is a very thin membrane. So when something's accumulating, you're going to see it. The next thing is dark red spots or a rash. And, Travis was talking about this, how he went to the dermatologist and he was diagnosed. There's a unique rash in patients with Fabry disease. The medical term is angiokeratoma. But what they say is it's non-blanching. So if you have the rash and you push down on it, it doesn't get lighter. And again, many of my patients have come to me after the dermatologist because, again, it's a very unique rash, although it doesn't really cause any problems. It usually starts presenting somewhere around late teenage years to, early adulthood. But the bigger problem that affects patients with Fabry disease is the inability to sweat. And sweating is what helps our temperature regulation. And then pain in the hands and feet. And this is a chronic issue. Some people, again, have more issues than others, but it's very debilitating and it gets worse in hot temperatures or cold temperatures. And, it's a very common complication of patients with Fabry disease. But as I said, some people just have, ring in the ears. Other people, sweat a lot. Everyone's a little bit different, but these are just some of the other body systems that can be affected. So the important thing is to take action and manage your symptoms. While your doctor may prescribe medicine to treat some of your symptoms, there's also action you can take to keep track of when you're feeling these things and avoid triggers and symptoms that may make them worse. Be aware. Avoid these things. Be realistic about what needs to be done and when. And ask people for help, like, for instance, with household chores or errands. For instance, if it's 85 degrees out and you need to mow your lawn, and you know that if you go out and mow your lawn when it's 85 degrees out, you're going to be down for 3 days, don't do it. Get someone to do it. Don't keep pushing yourself and say, I can do it, I don't want to ask anybody. Ask somebody because it's just not worth what you're going to go through. Be well. Do things that you know will help you feel better. Increase your water intake. Engage in low-impact activities like swimming. Swimming is a great exercise because it increases your blood flow, It also, releases endorphins that make you feel happy. Yeah, a lot of people jog, but if you can't sweat and you go on a jog, your body temperature is going to increase, and you're going to be like, I don't know why people like that. I hate jogging. I feel like dirt when I'm done. But swimming, what's great about swimming is it cools your body when you're doing it. One of my patients once came to me and said, one of my friends that I know that also has Fabry disease, got a letter from his doctor and was able to defray the cost of the pool with insurance. Could I have a letter? And I'm like, sure. So I wrote the letter, and it worked, so that was great. And so he got a swimming pool, and the next year when I was seeing him, I said, how's everything going? He goes, on a hot day in the summer, I jump in the pool for 20 minutes after I get home from work, I swim for 20 minutes, and I feel so much better. Which gets to my next thing, is break negative thoughts and patterns. Seek ways to support both mental and emotional well-being. And your mental well-being and emotional well-being is just as important as your physical well-being. And finally, be prepared. Keep items that will help you deal with these symptoms easily accessible. Prepare for changing weather. Be prepared with the medications, the warm and the cold compresses, the acute pain and the headache medicine. And rest before and after activities. Travis, can you talk a little bit about things that work for you?
Yes, I do, Dr. Jones. Part of the struggle of managing the symptoms of Fabry disease is that it's so different for everybody. I had to learn how to manage my symptoms in order to keep going. I had to adapt. And finding what works took trial and error, like for my GI symptoms. Big thing for me with GI is diet. Knowing what will set me off and what will not is important. For example, if I were to eat pizza today, I could be fine. But if I were to eat pizza tomorrow, it may give me stomach problems. So it's like a surprise party. You don't know when it's going to show up or how long it's going to last and what's going to happen. For me, it's about dealing with it and doing the best I can. If I was to share some advice about GI symptoms, you need to know what triggers you and to know what doesn't. I really like sweets. They don't always like me. Ice cream, cookies, coffee can all trigger me at times, but sometimes they don't. And it's important that I recognize that they may trigger me so I can be prepared for the surprise party and know what to do about it. So trial and error is really important, and so is moderation. At first, keeping a diary of food triggers was helpful. I had a journal and noted what foods would work and what foods would not. I also kept track of what symptoms would flare up and when, and would note the severity of my symptoms on a scale of 1 to 10. This information is good because you will learn how to adapt from your own experiences, and it can help you and your doctors to identify trends that you may not be aware of. My other tip for you is to know your body, is know your limitations. You have to know how far you can push yourself. The more you know yourself, the better, because it will help manage your Fabry symptoms. So for me, if I have a big night, I know to rest or to take a nap before I go out. When I have stomach issues, I usually have bad back pain that goes with it. So I know that a heating pad works, and I know that I have to lay down and sleep so that those symptoms will pass or subside. So it's important to know your body and to be mindful about it. When I get honest with myself, I had to learn that the more I exert myself, the greater the chance that my symptoms would flare up. And now, if I don't push myself too far, the better it is for me. In addition to knowing yourself, this means that you have to make sure that you talk about it with other people, whether it be family, friends, a significant other, or even a counselor or psychologist, someone that you feel comfortable with. You have to let people know where you're at, physically, mentally, emotionally, and yes, this may be uncomfortable. But if people don't know what's going on, then they don't know how to help you or even that you may need help. I'm sure all of you at some point have felt down and out or isolated and depressed. It's not fair for you to sit and suffer in silence, whether it be if you're at a family event or spending time with friends. Speaking up and excusing yourself so you can lie down, or speaking up and telling someone that you're having a bad day can make you feel better and less alone. You just have to be willing to open up and to be honest with the people around you. And I know how difficult that it can be, because I struggled with opening up, because I already felt embarrassed. And even though I was different, I didn't want to be viewed differently. But I realized that the more you can be open about things, the better it is for you and everybody else. Because let's be honest, Fabry doesn't just affect you, it affects the whole family. So make sure your family is also part of the solution. In addition to helping me out of how I feel mentally, my family is always looking for possible things that I may have not considered or heard of for managing my other symptoms like pain. I take medicine given to me by my doctor, and I use essential oils, but recently a family member found CBD oil and encouraged me to try it, and it's actually worked out well for me. However, if you're going to try alternative medications or herbal treatments, make sure you let your doctors know and that they are okay with it. And even though our symptoms are tough to deal with, it's important to find the good and to celebrate the small victories. And I know that's difficult to do, especially when it gets very bad. But you have to try and find the positive in it, because if not, it will consume you and consume your life. So much of it is perspective and how you look at it. If you're able to get your pain down from a 10 down to a 7, well, that's a positive. That's a good day. And I realize that it may seem hard to see the big picture until you get older, but the sooner that you can find the positives, the better. I told you that I stopped treatment, and it turned out that wasn't so good for me. But I did some research, and I found a clinical trial, and I got back on treatment. What I tell myself all the time now is that I'm helping myself in the long run, in the future, because there is so much about Fabry that you don't see, and I have so much to live for. Dr. Jones, what do we need to know about the hidden impact of Fabry disease?
Well, Travis, Fabry is a lifelong disease, and over time, it can have lifelong effects on your body. And that's why it's important to know how the fatty buildup occurs and affects you. At the beginning, there's a mild buildup of these, fatty buildups in the kidney, the heart, and the brain. And sometimes there may not even be any symptoms. But as time goes on, this buildup becomes more moderate, and it's starting to cause tissue damage and cell damage. And then eventually we get to irreversible damage, and the cells are dying. And this is when the symptoms start becoming worse. But everyone's a little bit different, and we're not sure what organ might go first, and then finally organ failure. So, some people, the heart is the most affected organ or goes first. Other people, it's the kidney or the brain, and there's no way for us to know what it is. It's important to understand that this buildup is occurring before you have symptoms, and that the more the buildup is there, the more severe the symptoms. And that's why treatment is important early, even before we're having symptoms, which is a hard thing to get it's like, I have Fabry, but I'm not having this problem. Why should I be on therapy? So let's first look at the kidneys. One of the first things that happen in the kidney, an early sign, and often you don't even have symptoms of this, is there's something called protein in the urine. So remember I said the blood pumps out of the heart? It goes into the artery, into the kidney. And the kidney, the lysosome is a recycler, and whatever we're done with, it breaks it up into little pieces and sends it into the blood. But the kidney is how we get rid of it. So we urinate it out. So what happens, if you think about it, all this blood goes into like a big container, and then it pulls back out all the good stuff that we still need and gets rid of everything else. But sometimes that's not very efficient, and we see protein and something called microalbumin in the urine. You're not going to have any symptoms for that, but it's an early sign that there might be something going on, from Fabry disease in your kidney. And then reduced kidney function. The medical term for this is decreased GFR or glomerular filtration rate, not that you care about that, but that's just that whole system of reabsorbing. You're just not doing it well. And then there's a blood test known as creatinine that starts elevating in your blood. So that's the blood test that the doctors are looking at to look at kidney disease. But you know, by the time that the creatinine starts rising, you have a significant amount of kidney disease. And then they may see cysts by doing an ultrasound in chronic kidney disease. And then kidney failure or end-stage renal disease. You know, that's at the end point when you may need more significant therapies for your kidneys. Let's look at the closer impact of the fatty buildup in your heart. So some of the early signs are reduced heart function. Maybe the heart isn't pumping well enough. Or EKG abnormalities. Our heart is our most important muscle, but it also has its own electrical system. And so the way the heart pumps is the first beat is the small parts of the heart, the atrium pumps, then the ventricle. So boom, 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 and it's in synchrony. And the EKG is looking at the electrical signals, and sometimes there's very subtle abnormalities. It doesn't really affect you, and the decreased heart function probably doesn't affect you, but it's early signs. Then, as it goes on, you might have chest pain, and the medical term for that is angina. And then the heart may be enlarged. And you're not going to know your heart's enlarged unless you get certain studies. One is an ultrasound of the heart, and we're going to talk about an MRI. And then it goes from maybe some mild EKG abnormality to what's called an arrhythmia or an irregular heartbeat. And then atrial fibrillation, remember we were talking about the electrical system? Well, the atrium is not pumping in sequence with the ventricle. So the atrium's trying to pump and the atrium's like this and the ventricle is like trying to pump. And obviously the blood's not going to go very well when it's not going in synchrony. And finally, heart failure. Heart failure is when the heart pump cannot pump blood throughout your body. Next, let's look at a closer impact of the fatty buildup on the brain. The small capillaries of the brain can become obstructed, and that can result in migraines or small blood vessel abnormalities. And then the next step is MRI abnormalities. There's changes in something called the white matter. I need a radiologist to look at this because I'm not great at looking at MRIs myself. But anyway, or mini strokes, transient ischemic events, TIAs. And transient means actually it can get better, but it is a sign things aren't going well. And then brain bleeding or cerebral hemorrhage, dementia, memory problems, and stroke. And as I said, these memory problems can be very subtle and they can get worse over time. Some people have no issues with their brain and other people have more significant issues. And then there's also other body parts that are affected by the accumulation of this glycolipid. There can be chronic cough or breathing problems. Bone density can be reduced, and that can cause something called osteoporosis. And when individuals have weak bones, there could be a minor fall or trip, and you could end up with a fracture. There can also be pain and swelling, chronic headaches, this pain in the hands and feet, the burning and the tingling, and as Travis was saying, the lymphedema, the edema of your limbs. Eyes, there can be cataracts. Again, that oral keratopathy I don't worry about, but the cataracts is a problem. Ringing in the ears, progressive hearing loss, and as we were saying, like dizziness or vertigo. Stomach issues, chronic abdominal pain, chronic GI issues. And then finally, the skin issues. Why treatment matters. So we've been talking about Fabry is getting worse over time as the fatty buildup progresses. Undiagnosed and unmanaged Fabry disease can reduce life expectancy by 15 to 20 years. This is why treatment matters, because it may improve or reduce Fabry's impact on life expectancy, even though we don't exactly know how much it will improve, we do know that therapy will improve things. But the earlier we start, the better. So it may help or prevent some of the more significant renal issues. It may help or prevent some of the cardiac complications. It may help or prevent memory problems, or it may help or prevent some of these long-term effects. You know, I had a mom come to me once and said, you know, she had a 5-year-old and she had known her son had Fabry at a very young age because her father had Fabry and she had Fabry and she had just started on therapy. And she's like, you know, since he was 3 years old, he can't be outside. His face turns red. His tummy hurts all the time. And I want to start him on therapy. So we started him on therapy at 5. And I did it as in a infusion center to begin with, and then we moved to home infusion. And so every other week the nurse comes and she puts an IV in him and puts an IV in the mom, and he gets 2 hours of his screen time. And after about a year, he started sweating again. And the adult males that I see for Fabry do not start sweating, but he did. And he's 10 years old now, and he's on the soccer team. And he doesn't, he still has some belly pains, but it's not as much as it was before. So, my hope is that by starting him earlier, we may be able to keep it in the mild stage. It's harder to get rid of this glycolipid once it's there. We're better off trying to get to it before it gets worse. Staying on top of this is important because it's the best way to help yourself. Knowledge is power. Why treatment matters? Undiagnosed and unmanaged Fabry can decrease life expectancy. It can decrease life expectancy by 20 years in males and 15 years in females. We have not been giving enzyme treatment or any other kind of therapy for long enough to know how much improvement we may get with therapy. So I can't give you that number. But at this point, we just haven't been giving it long enough to know how much improvement. But what we do know is this is what you have in store if you don't get on therapy. So staying on top of Fabry is a great way to help yourself. Every 6 months, looking at kidney function, blood and urine tests. Every year, looking at the heart function, that EKG, which is a spot in time, looking at the electrical function. A Holter monitors, you have to wear these wires for like a day so that the cardiologist can look at how your heart is going like long term. Other heart risks like lipid, if you have elevated cholesterol, that can coat the inside of your vessels and you're pushing with your large cells on the outside, that's going to decrease blood flow even more. And there are medications that can be given for that. And every 1 to 3 years, looking at heart function, MRI, cardiac MRI, hearing evaluation, brain imaging, lung function, and with spirometry. Now, there are a lot of members of your care team that can help in different ways. Fabry disease specialist is somebody who's I like to think of that like the air traffic controller, looking at all of your issues of Fabry disease. Sometimes that's a medical geneticist. Sometimes it's a primary care, physician, and sometimes it's even like a nephrologist. But also the genetic counselor can help in both family planning as well as coordination of care. So a genetic counselor is often in the medical genetics kind of team to help with coordination of care. But you also need a number of other physicians in your care team, including your primary care physician, the gastroenterologist if you're having issues with stomach and intestinal issues, pain management. There are special doctors that just manage pain, an ophthalmologist for the eye issues. I've said before, your mental health is just as important as your physical health. So a psychologist or psychiatrist to deal with those issues, the ENT specialist for ears, nose, and throat for the hearing issues, maybe the throat issues, a pulmonologist for the lung issues. Some neurologists also deal with the pain issues, but they can also deal with some of the ongoing neurologic issues or brain issues. And then lastly, I want to talk about the cardiologist and the nephrologist, because while some of you may need some of these other doctors, all of you are going to need a cardiologist and a nephrologist to monitor these issues. Now, some doctors know a lot about Fabry disease and some not so much. There's actually a downloadable guide that can help facilitate this conversation called rethinkfabry.com, and it's something you can bring to your physicians. You know, most physicians would not be insulted if you bring in some extra information if they felt that they didn't understand as much. And their goal is to help you as much as they can. But you have to be the advocate. You have to, sometimes be the one to bring that forward to your physician to make sure you're getting the best care you can. Next, look within your family. This may help you understand the long-term impacts of Fabry disease can have on your body. Since I'm a medical geneticist, I work a lot with families piecing together the family tree and genetic diseases. And usually when I find one patient with Fabry disease and I'm doing this family history, I find like 5. Nobody ever thought about it till the first person is diagnosed. And what happened to Travis is unfortunate that he didn't know, that other people in the family had it. So I go sometimes from a single individual that was diagnosed to many individuals. Because Fabry is inherited, and I'm just going to say we don't understand this completely, but I have certain large families that have more kidney disease. Some have maybe more heart disease. Someday they're going to come out with the article that talks about how this particular letter change in the gene causes this and the other thing causes that. They haven't yet. They might tomorrow. I don't know. But where we used to make the diagnosis of Fabry disease primarily through seeing the enzyme deficiency, that is not true of women. You really need the DNA test. So whenever I find a family, I always do genetic testing. And when I get the results back, I send it to the patient. I always, no matter what I test somebody for, I send it to the patient. But I tell people with Fabry disease, this is your copy of the genetic genetic report. And I want you to take a picture of this and keep it, with your camera or scan it into your computer, and you should send it to all of your relatives. It doesn't matter if the relatives live across the country. They could bring that particular piece of information into the doctor or the geneticist and be tested for this. And then they could know, what the changes in their family if they inherited that. If, for instance, you were my patient, you said, oh, my cousin, I think she has it, I'm gonna send her to you. Unless you gave me permission to use your medical information, I couldn't. But if you send it to your family members, that's implied consent. So it's something called HIPAA. We can't just, even though both of them, if I were Travis's doctor and he said, oh, my cousin, it wouldn't be enough unless Travis told me it was okay to use his medical information. But if Travis sends it out to people, then that's implied consent. So it doesn't matter where someone lives, they can get that information, and they can then take it upon themselves to, get tested for this. And as we keep emphasizing throughout this presentation, early treatment may reduce the hidden impact of these long-term complications. Travis, do you have any insights on your own family?
Sure. As I was listening to Dr. Jones, I was thinking about my own family. After I was diagnosed, we alerted our immediate family right away. What we learned was that my mom's cousin had it, and he was in a clinical trial. We never knew. So it's very important to communicate with your family about Fabry. I know it's a tough and a difficult conversation, but at the same time, it is something genetic, and it is in the family, and you owe it to them and to yourself to tell them what's going on. We learned that my cousin and I had the same symptoms, and because he didn't tell anyone, I was on a wild goose chase for over 11 years. Now, the treatment options do exist. It's more important than ever to help your family members get diagnosed. And after hearing Dr. Jones said about what can happen to us in the long term, I cannot say it enough. You have to take charge of your life. Every one of us has a powerful advocate on our side, and that advocate is you. You need to be your own best advocate. My cousin's brother also has the same symptoms as us, but he refuses to get tested. He lives in denial. As for me, I let life get in the way, and I did not make treatment a priority. And, I stopped treatment. But I continued with my Fabry checkups and educating myself because the long-term effects of the condition weighed on me. I understood what could happen as I got older, and I ultimately made the decision to take charge of my life. I realized that the sooner I dealt with it, the better, because if I didn't, the disease is progressive, and as we just learned, the longer we wait, the worse it gets. So I educate myself by attending FSIG conferences, NFDF conferences, and looking things up on WebMD or clinicaltrials.gov website to learn about potential new treatments and other options. And most important of all, I learned from other Fabry patients that I might meet in an infusion room or at conferences. However, it's not just enough to learn about Fabry. You have to apply it. You have to use what you learn to open up new conversations with your doctors and your nurses. So that is your greatest tool, your voice. Find yours. I often hear people say, oh, my doctor doesn't know what to do. My doctor doesn't do that for me. Say, well, what did you tell them? You can't wait for your doctor to read your mind or to guess how you're feeling because it's just not going to happen. Use your voice. Ask them questions. Tell your doctor about what's going on with you. And if you have trouble remembering some things between appointments, make a list, add to it as things come up. When I have a bad day or a bad week, I tell my doctor and I tell him how frequently I have symptoms. And believe me, I'm not vague. I go into detail. I tell him what's going on, what's going on with me, where I hurt. I want to help my doctor understand where I need help. So if I have a headache, I'm not just going to say I have pain in my head. I'm going to tell the doctor what side it's on, what it feels like, on a scale of 1 to 10, how much it hurts, how it impacts my functioning. The more information that you give, the more they are able to help you. Be as open as you can. If you're not open, it's only going to hinder you. And if you don't feel comfortable with something or you don't think something's right, it's probably not. Nobody knows your body better than you. I started having swelling at one point. So I did my online research. I learned it was lymphedema. So I found a lymphedema specialist, as well as other things that I can do to help manage that, like using compression stockings. And when I learned about a new Fabry clinical trial, I talked to my doctor and my nurses. I learned about it and enrolled, made the right decision that it was good for me. And I encourage you to educate yourself about potential treatment options and to get involved if you and your doctors decide that it's the right thing for you. I continue to be my best advocate, and I encourage you all to be your own best advocates. Push through, talk to someone with experience, open your mind, and let people help you. Dr. Jones, do you have anything to add?
Thanks, Travis. So the one thing I really want to emphasize is that it's important for you to take a stand about the hidden impact of Fabry disease. Denial is natural, but it's really not a management strategy. Take action and don't delay treatment, even if you feel fine, because this is accumulating within you even when you're not having symptoms. Talk about your Fabry with other members of your family and get diagnosed and start on treatment as well. Talk about your experiences, help other family members. And finally, be proactive. You're your best advocate. Look into other options like long-term health. Know that, what you need to do. Learn as much as you can. Travis, do you have any other final thoughts?
Dr. Jones, I take a stand every single day. Let's face it, Fabry is tough. It's the bad hand that we've all been dealt. But We have to deal with it sooner rather than later because it's not going away. It's going to keep building up. When I was diagnosed, there was no treatment for Fabry, and life expectancy was a little over 50 years old. But there's been good progress made with treatment in the last 15 years. So just think about what's to come in the next 15 years. And even though treatment doesn't get rid of all of our symptoms, it gives us life and the opportunity to be with the people who matter most in our lives. So take action. I know it's hard, it's difficult to see the big picture because it's very easy to focus on the bad and to lose hope. But as powerful as all those negatives may be, I can tell you from my own experience that you are the most powerful. Find your positives and find your wins. Believe that you can rise up to the challenge and find your inner strength. Open your mind and try different things. Find your voice, be your own best advocate with your doctors, your family, your friends. Continue to learn and talk to your doctors about things that worry you and about new things that you may learn. Fabry affects the whole family, so include your family. Talk to them openly and honestly, and let them be part of helping you. And when you find something that works for you, share it with the others living with Fabry. Share it with the community. If you can help yourself, you can help others. So get active with the Fabry Network. Surround yourself with people who have experiences and wisdom, knowledge that you can learn from, whether it be emotional, physical, or mental. Doing so with other Fabry patients can really help with coping. And my final thought is this: to always remember, we are all in this together. Living with Fabry successfully is how you adapt and how you evolve with it. Live in the solution. Thank you all for joining us tonight.
Thank you, Travis, for sharing your story. And thank all of you for joining this webinar and for your time and attention.